Can exercise cause the remission of type 2 diabetes? Well, a couple years ago, Diabetes Canada came out with a position statement that talked about different strategies like bariatric surgery, low-calorie diets, as well as exercise training to potentially put diabetes for type 2 into remission. And the study that they actually were citing for the exercise training was called the metabolic U-turn trial. So in this video, it's going to be a six-part series. This one is going to be an overview of the trial. And then in later subsequent videos, we're going to get more into the specifics of what they actually did in the trial. So type 2 diabetes remission is about achieving a specific A1C without the need for diabetes medications for a minimum of 3 months. And remission to prediabetes would be getting down between 6% to 6.4%, and remission to a normal range would be getting under 6%. So the participants in the U-turn trial, they had diabetes for less than 10 years, so that's an important point. They had less than 3 diabetes medications that they were taking, and their BMI, body mass index, was between 25 and 40. There was a lot more requirements that the participants needed to meet, but those are the probably most important. The U-turn intervention was primarily exercise, but they did have nutrition recommendations for people and protocols, as well as protocols for sleep. In nutrition, the recommendation was to have a diet compromising of 45 to 60% carbohydrates, 15 to 20% protein, and 20 to 35% fat, with less than 7% coming from saturated fat. And there was a modest energy restriction in the first 4 months. So they did tell people to stay within a certain calorie threshold. Now, with sleep, fairly simple, getting people to have a regular wake and bedtime, and trying to get people to sleep at least 7.5 to 8.5 hours per night. Okay, with exercise, this was really the kind of the meat of the study. So they did aerobic exercise, and they eventually built up to 60 minutes, 5 to 6 days per week. Now, they didn't specify what type of aerobic exercise. They said it could be indoor, outdoor, on machines, on bikes, treadmills. There are many different options, but they actually didn't specify in the study. But they used heart rate to give the recommendation, so heart rate ranges. Resistance training, the protocol was to do 30 minutes 3 times per week, and they basically had people do 5 types of exercises covering the full body. So they had some type of lower body exercise, something that was for mainly the front part of the lower body, and then they also had more of a back dominant lower body exercise. They had some type of compound pulling exercise like a row, and then a compound press, and then a core exercise. So those were the 5 categories. They also got people to increase their steps to 10,000 steps per day. When it comes to the results, what they saw was that over 30% of the people in the active group, the people doing the intervention, over 30% saw type 2 diabetes remission after 12 months, whereas just under 10% in the control group, which was kind of standard of care. And it was interesting that there was actually no change in weight or A1C between the groups. And that got me thinking, okay, what's actually happening here? If there's no change in A1C, well, actually 58% of the U-turn participants stopped taking blood glucose lowering medication at 12 months. So that was really where the study had a big impact on reducing the medications that people took. There are some limitations to the study. So the results or the differences between the groups of who actually went into remission and who didn't, between the control and the intervention, that actually wasn't statistically significant, most likely because it was a small scale study. And remission wasn't actually something that the authors were looking at originally. This was just something that came up after they did the study and they wanted to look at the differences in remission between the two groups. And remission did go down after 2 years. So it went from 37% all the way down to 25%. My biggest takeaway from this study is not that it's possible. I did know that, you know, I've had a lot of clients that start exercising a lot more and do put their diabetes in remission. The biggest takeaway is that there's kind of a really nice um, map to follow. And regardless of where you're at and where you get your blood sugars to, if you do work towards increasing your physical activity, you're going to see a benefit no matter what. So for me, this is just kind of a nice way to highlight some of the benefits of exercise and be able to talk to people that are interested in doing a little bit more than the standard recommendations for exercise. So if you're interested in learning more about what people actually did in this trial, make sure to subscribe to this channel for more videos. We're going to come out with another 5 videos detailing the different types of exercise as well as the nutrition and sleep protocols in this study.